Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024, investigating the optimal treatment for a critical condition in our canine companions known as adrenal crisis. This research, conducted by Laura Brenori, Olivia X. Walesby, Daniel H. Lewis, and Alistair M. Bogue, sought to compare two different approaches for managing dogs presenting with this endocrine emergency. Adrenal crisis, also known as acute hypoadrenocorticism or Addison's disease, is an uncommon but serious condition in dogs characterized by a deficiency in crucial hormones produced by the adrenal glands, namely glucocorticoids and mineralocorticoids, or sometimes both. It's estimated that a significant portion, around 30%, of dogs diagnosed with hypoadrenocorticism are first identified when they are in the midst of an adrenal crisis. This acute presentation is a true veterinary emergency that demands immediate and intensive medical intervention. While there is a considerable amount of knowledge regarding how Addison's disease develops, how it manifests clinically, how to diagnose it, and how to manage it in the long term, the scientific evidence regarding the very best way to treat a dog experiencing an acute adrenal crisis has remained surprisingly limited. Traditionally, these critical cases have been managed with aggressive intravenous fluid therapy aimed at restoring blood volume and circulation, alongside the administration of fast-acting glucocorticoid medications. In the realm of veterinary medicine, two glucocorticoids, dexamethasone and prednisolone, are the ones most frequently used in such emergency situations. However, guidelines in human medicine strongly recommend hydrocortisone as the primary choice of corticosteroid for patients in adrenal crisis. There are several reasons cited for this preference in human medicine. Firstly, hydrocortisone possesses a balanced activity, providing both glucocorticoid and mineralocorticoid effects, which are both typically deficient in an adrenal crisis. Secondly, hydrocortisone has a relatively short half-life in the body. This is seen as an advantage because if a patient were mistakenly given hydrocortisone and did not actually have hypoadrenocorticism, the risk of significant long-term negative consequences would be low. Furthermore, hydrocortisone is generally considered to be relatively inexpensive, has a good shelf life, and is widely available. Dexamethasone, on the other hand, is frequently utilized in veterinary medicine, particularly in situations where the results of an adrenocorticotropic hormone, or ACTH, stimulation test, which is crucial for diagnosing Addison's disease, are not immediately available. This is because dexamethasone does not directly interfere with the measurement of cortisol levels in the assay used for this test, although it will still suppress the hypothalamic pituitary adrenal, or HPA, axis, which is the body's central control system for these hormones. Interestingly, there has been some prior investigation into the use of hydrocortisone in dogs experiencing adrenal crisis. One study examined the use of a continuous rate infusion, or CRI, of hydrocortisone in 30 dogs undergoing an adrenal crisis, alongside intravenous fluid therapy. This study suggested that such a protocol, using a hydrocortisone infusion rate of 0.5 to 0.625 mg per kilogram of body weight per hour, was safe and effective, leading to a rapid improvement in electrolyte imbalances with an average hospitalization time of around 2 days. However, another study that compared hydrocortisone CRI to treatment with dexamethasone or prednisolone boluses in dogs with adrenal crisis did not find any additional benefits in the hydrocortisone CRI group in terms of how quickly electrolyte levels normalized, and in fact, noted that hospitalization times tended to be longer in the hydrocortisone CRI group. Given these somewhat conflicting findings and the general lack of robust evidence in veterinary medicine, the current study we are discussing today aimed to further investigate the outcomes of dogs diagnosed with adrenal crisis that were treated with either a hydrocortisone continuous rate infusion or intermittent intravenous boluses of dexamethasone. This retrospective study spanned a 6-year period and involved data collected from 3 different veterinary referral hospitals in the United Kingdom. The primary goal was to compare the effects of these two treatment approaches on the time it took for electrolyte and acid-base imbalances to return to normal. Secondary outcomes that were also examined included the total length of hospitalization, how frequently electrolyte levels needed to be rechecked, and the overall survival rate of the dogs until they were discharged from the hospital. The researchers hypothesized that using a continuous infusion of hydrocortisone might lead to a more rapid correction of the metabolic and electrolyte disturbances compared to administering dexamethasone intermittently, which they further speculated could result in shorter hospital stays. Now, let's turn our attention to the results of this important study. The researchers meticulously reviewed the electronic medical records from March 2016 to May 2022 and identified a total of 39 dogs that met their strict criteria for inclusion in the study. These dogs all displayed clinical signs and had electrolyte abnormalities strongly suggestive of typical hypoadrenocorticism, such as low sodium levels, high potassium levels, or a specific ratio between sodium and potassium that is indicative of the condition. Importantly, these clinical suspicions were confirmed by a consistent ACTH stimulation test performed before any exogenous corticosteroids were administered. Additionally, all included dogs had undergone sequential venous blood gas analyses at regular intervals during their hospitalization, and these results were available for review. Dogs that had already received corticosteroid treatment within the 48 hours prior to presentation or were already on long-term corticosteroid therapy for previously diagnosed hypoadrenocorticism were excluded from the study. Of the 39 dogs included, 11 were treated with a continuous rate infusion of hydrocortisone, while the remaining 28 received intravenous boluses of dexamethasone. When the researchers compared the two groups at the time of admission, they found no significant differences in several key factors including age, sex distribution, neuter status, body weight, and initial levels of chloride, potassium, ionized calcium, packed cell volume, total solids, and bicarbonate. However, there were two notable exceptions. The dogs in the hydrocortisone group presented with a significantly lower average serum pH compared to the dexamethasone group. Furthermore, the initial serum sodium levels were also significantly lower in the hydrocortisone group at the time of hospital admission. When the researchers analyzed the primary outcome, which was the time it took for serum sodium and potassium levels to normalize, they found no statistically significant difference between the two treatment groups. The median time for sodium levels to return to normal was 33 hours in the hydrocortisone group and 16 hours in the dexamethasone group, although this difference did not reach statistical significance. Similarly, the median time for potassium normalization was 17 hours in the hydrocortisone group and 16 hours in the dexamethasone group, again with no significant difference observed. There was also no significant difference in the time it took for the ratio of sodium to potassium in the blood to normalize between the two groups. Looking at the secondary outcomes, the study found no significant difference in the total duration of hospitalization between the two treatment groups. The median hospitalization time for dogs in the hydrocortisone group was 48 hours, while for the dexamethasone group it was 57 hours. This difference was not statistically significant. Similarly, there was no significant difference in the number of times electrolyte concentrations were measured during hospitalization between the two groups, with both groups having a median of 4 to 4.5 measurements. Furthermore, the case fatality rate, meaning the proportion of dogs that did not survive, was also not significantly different between the groups, with 2 deaths occurring in the dexamethasone group and none in the hydrocortisone group. Interestingly, the researchers did observe that 3 out of 10 dogs in the dexamethasone group that had normal sodium levels when they were first admitted to the hospital developed high sodium levels, or hypernatremia, by the end of their treatment. This was not observed in the hydrocortisone group. Further analysis looking at the changes in electrolyte and acid-base parameters over the first 48 hours of treatment revealed significant changes over time for all measured variables, which the researchers attributed to the values generally moving towards normal. They did find significant differences in the absolute values of serum sodium and bicarbonate concentrations between the two treatment groups over this initial 48-hour period. Additionally, the rate of change in serum pH was significantly different between the two groups during this time. Regarding the use of emergency treatments for high potassium levels, such as calcium gluconate or glucose and insulin, there was no significant difference in the frequency of their use between the hydrocortisone and dexamethasone groups. Finally, the study also looked at the type of intravenous fluids administered. Both 0.9% saline solution and lactate ringer solution, or LRS, were used in both treatment groups, and the researchers found no significant effect of the fluid type on the rate of change of any of the serum electrolytes or pH values. However, they acknowledged that their ability to fully assess the impact of fluid choice was limited by the lack of detailed data on the total amount and rate of fluid administration for each individual dog. Now, let's move on to the discussion of these findings. The researchers began by reiterating that the very best way to manage adrenal crisis in dogs remains an area where definitive evidence is lacking. They highlighted that current veterinary practice in the United Kingdom often involves using intravenous dexamethasone as the initial hormone replacement, followed by oral prednisolone and fludrocortisone for long-term management. This contrasts with human medicine guidelines, which favor hydrocortisone due to its balanced glucocorticoid and mineralocorticoid activities, making it theoretically well-suited for addressing the hormonal deficiencies seen in adrenal crisis. The ready availability, relatively low cost, and short half-life of hydrocortisone are also seen as advantages in human medicine. The current study's key finding was that no significant differences were detected in the outcomes of dogs in adrenal crisis treated with either intravenous dexamethasone boluses or a continuous rate infusion of hydrocortisone. This included the time taken for sodium and potassium levels to normalize, as well as the overall duration of hospitalization and the survival rate. This result is somewhat different from a previous study that suggested longer hospitalization times and more intensive monitoring were required for dogs receiving hydrocortisone infusions. However, the hospitalization times observed in this current study, with a median of around 2 days in both groups, are consistent with findings from other prior research. The researchers addressed concerns that had been raised previously regarding the rate at which sodium levels are corrected with hydrocortisone use, noting that their data did not indicate an unsafe rate of sodium correction in the hydrocortisone group. Furthermore, the observation that some dogs in the dexamethasone group developed high sodium levels during treatment led the authors to speculate that the mineralocorticoid activity of hydrocortisone might offer some protection against this. Regarding the management of high potassium levels, a common and potentially life-threatening electrolyte abnormality in adrenal crisis, the study found that most dogs in both groups were managed successfully without needing specific emergency treatments for hyperkalemia, and there was no significant difference in the need for such interventions between the two groups. This contradicts a recent study that had suggested dogs receiving hydrocortisone infusion might be less likely to require emergency management for high potassium. The importance of fluid therapy as a primary treatment for adrenal crisis, particularly in addressing hypovolemic shock, was underscored by the researchers. While much of the literature in both human and veterinary medicine suggests normal saline as the preferred initial crystallid fluid due to its high sodium content and lack of potassium, more balanced crystallide solutions like lactate ringer solution have also been advocated. In this study, both types of fluids were used in similar proportions in both treatment groups, and no significant impact on the rate of change of electrolytes or pH was observed. However, the researchers acknowledged the limitation of not having detailed data on the total volume and rate of fluid administration. The study also highlighted the significant variability in the doses of both dexamethasone and hydrocortisone used in clinical practice, which was reflected in their study population. The hydrocortisone infusion rates ranged from 0.3 to 0.5 mg per kilogram per hour, with experimental data suggesting that a dose of 0.5 to 0.625 mg per kilogram per hour should provide adequate hormone replacement. It was noted that the lower end of this range might not always achieve optimal physiological levels. Similarly, the doses of dexamethasone administered varied widely, and given its much higher potency as a glucocorticoid compared to hydrocortisone and its lack of mineralocorticoid activity, these varying doses could have resulted in either under or oversupplementation of glucocorticoids in some dogs, potentially affecting the rate of electrolyte and acid-base correction in the dexamethasone group. While the hydrocortisone group in this study had a numerically shorter median hospitalization time compared to the dexamethasone group, this difference did not reach statistical significance. The researchers suggested that this could be due to the limited number of cases in their study. This contrasts with the prior study that reported significantly longer hospitalization times with hydrocortisone infusion. Interestingly, unlike that earlier study, this current research did not find that dogs treated with hydrocortisone infusion required more intensive monitoring in terms of the frequency of electrolyte checks. The demographic characteristics of the dogs included in this study, such as their median age and the prevalence of certain breeds like poodles and poodle crosses, were consistent with what has been reported in previous studies on canine hypoadrenocorticism. The authors acknowledged several limitations of their study, primarily its retrospective design, the relatively small number of cases, and the lack of standardized treatment protocols across the different participating institutions. Additionally, the absence of blinding or randomization means that the possibility of clinician bias in choosing one treatment over the other for certain cases cannot be entirely ruled out. For instance, the fact that the hydrocortisone group presented with lower initial sodium and pH levels suggests that clinicians might have preferentially used hydrocortisone in more severely affected animals. Furthermore, the use of different blood analyzers and external laboratories across the institutions could have introduced some variability in the absolute values obtained. Despite these limitations, the researchers concluded that their retrospective study adds to the growing body of evidence suggesting that hydrocortisone infusion is a safe and effective treatment for dogs presenting with acute adrenal crisis. Importantly, their findings showed that this treatment protocol was not associated with an increased risk of rapid or dangerous electrolyte or acid-base changes, did not lead to longer hospitalization times, did not necessitate more intensive monitoring, and did not result in a higher case fatality rate when compared to the more commonly used dexamethasone protocol. The authors ultimately suggest that future prospective, randomized controlled trials will be necessary to further investigate and definitively establish the optimal treatment strategies for this critical condition. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.